You know the story: fatigue that doesn't make sense, periods so heavy they steal your energy, cramps that feel like they're tearing you apart. For some, it's written off as stress. For others, it's dismissed as just part of being a woman. But behind those symptoms could be something far more complex: fibroids. Today, we're talking about fibroids. Not just the textbook definition, we're going deep. Because too many women are suffering in silence. Especially Black and brown women, who are statistically more likely to develop fibroids and less likely to get the support they deserve. This video is your roadmap. What are fibroids? What are the symptoms? The treatments? The truths the world isn't telling us. We're breaking it all down. Let's go. Fibroids, also known as uterine leiomyomas or myomas, are non-cancerous growths of the uterus that often appear during a woman's reproductive years. They can be microscopic or grow to the size of a grapefruit. Some women have one. Some have many. Some no. Many don't. Here's the medical breakdown. Fibroids are made of muscle and connective tissue. They develop when a single smooth muscle cell in the uterus multiplies and creates a firm, rubbery mass. They're not cancer, but they can still wreak havoc. And they're hormonally driven, primarily influenced by estrogen and progesterone. Up to 80% of Black women will develop fibroids by age 50. 2 to 3 times more common in Black women than white women. Risk factors: genetics, age, diet, high blood pressure, vitamin D deficiency. There's not just one kind of fibroid. Where they grow matters. How they affect your body. Even more. Let's break it down. 1. Intramural fibroids. Grow within the muscular wall of the uterus. Most common type. Can enlarge the uterus and cause pain, heavy bleeding. 2. Subserosal fibroids. Develop on the outer wall of the uterus. Can press on bladder, bowels, cause bloating, frequent urination. 3. Submucosal fibroids. Just beneath the lining of the uterus. Less common, but often cause severe bleeding and fertility issues. 4. Pedunculated fibroids. Attached to the uterus by a thin stalk. Can twist and cause sharp pain if the stalk is compromised. Here's where fibroids show their true colors. For some women, they're silent. For others, they take over your life. Common symptoms: heavy or prolonged menstrual bleeding. Severe cramping. Pelvic pain or pressure. Back pain. Pain during sex. Frequent urination or difficulty emptying the bladder. Constipation. Fatigue from anemia. Infertility, miscarriages. And here's the hard part: many women normalize these symptoms. They think it's just part of being a woman. But normal isn't supposed to mean painful. You don't have to live with this. Diagnosing fibroids starts with listening to your body. But to get answers, you'll need medical imaging. Pelvic exam detects abnormalities in uterus shape. Ultrasound, primary imaging tool, non-invasive. MRI, more detailed imaging, helpful for surgical planning. Sonohysterography uses saline and ultrasound to visualize the uterine lining. Hysteroscopy, a camera is inserted into the uterus to inspect its walls. Now for the most important part: you have options. The best treatment is personal. It depends on your symptoms, your goals, and your body. Watchful waiting for asymptomatic fibroids. Hormonal treatments: birth control pills, GnRH agonists to shrink fibroids. IUDs, reduce bleeding and cramps, e.g. Mirena. Uterine fibroid embolization, UFE blocks blood flow to shrink fibroids. MRI-guided focused ultrasound surgery, FUS high-intensity ultrasound waves break down fibroids. Myomectomy, surgical removal of fibroids, uterus preserved. Hysterectomy, removal of uterus, considered a last resort. Medical care matters. But don't underestimate the power of lifestyle. Your habits can make a difference. Anti-inflammatory diet, leafy greens, berries, turmeric. Avoid high estrogen foods, red meat, dairy, alcohol. Exercise regularly, especially cardio and yoga. Manage stress, meditation, therapy, sleep hygiene. Vitamin D, get tested, supplement if needed. Fibroids don't just affect your body, they impact your identity, your self-esteem, your relationships. It's okay to grieve. It's okay to cry. But you don't have to do it alone. Online communities, e.g. The White Dress Project. Therapy, individual or group. Support from partners, friends, family. You made it to the end. And now you know what fibroids are. You know what they look like, feel like, and how to fight them. This isn't just about information. It's about empowerment. So share this video. Start the conversation. Help someone who's still in the dark. Your body. Your story. Your power. Thanks for watching, and this is the kind of content that lifts women up. Until next time, stay strong, stay educated, and stay beautifully you.